Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about epidural injections. An epidural injection is an outpatient procedure involving steroid and numbing medicine into the epidural space. Now, it's designed to relieve the pain from nerves that are being pinched. The injection does not go into the spinal cord or into any nerve roots. Okay? Epi means around, and dura is the name for the covering of the spinal cord. So it goes into the area around those structures, not into anything. What are the indications? Well, anytime a nerve is getting pinched and causing pain, which is known as sciatica in the low back, okay? If it's in the upper spine, around the neck, it's called radiculopathy. Spinal stenosis is when overgrowth of bone and soft tissue from aging lead to nerve roots getting pinched, either in the neck or the low back. Degenerative disc disease can lead to significant disc bulging. Actually, you kind of see that here. This was a disc. Here you see a large bulge going back and pinching on a nerve root. That gets inflamed, and that causes the pain, either sciatica or radiculopathy. Okay? If this gets degenerated and has a tear in the outer part called the annulus here, that can also cause inflammation and sciatica or radiculopathy. Okay? Compression fractures due to osteoporosis in the vertebral body can also lead to inflammation and pain in the area and do well with an epidural injection. There are 3 different types of epidural injections. We're going to go through them. This one is an interlaminar epidural injection. They call it that because this is a lamina bone and this is a lamina bone. So the area where the needle goes is between the lamina, so it's interlaminar. There's no bone there, it's all soft tissue. So the needle will go through this ligament tissue, and then as it gets through that, that's then the epidural space, and that's where it's injected. Okay? So it's a little bit of an indirect injection. You can see that the actual nerve roots come out here and here and here. So it's not placing the steroid exactly where the pinching is occurring, but it's usually close enough. Transforaminal is the newest type of epidural injection. The way it's named is as follows. Here, this space here is called the foramina. Foramina, okay? That's where the nerve root is coming out. And the hole is called the foramen. So the needle goes close to where this nerve root comes out, so that's why they call it transforaminal. And the steroid goes in, and that's usually where a disc herniation is occurring. Okay? So it places the steroid closer to where the nerve's actually getting pinched. The third type is called a caudal epidural injection. Now, this doesn't go into the lumbar spine at all. It actually goes into the sacrum. There's a hole here called the sacral hiatus, and the needle goes in and a large amount of steroid and numbing medicine is placed, and it will actually migrate up a bit and cover the bottom 2 levels or so. So it works well for something like spinal stenosis, where you might have a couple different nerve roots getting pinched. It can cover those areas. How are they performed? This is an outpatient procedure. Usually takes half an hour or less. The pain doctor will inject some numbing medicine and possibly use IV sedation. Okay? Real-time x-ray is usually used now, called fluoroscopy. In the past, this was often not used, and studies showed that 40% of the time, the steroid was misplaced. Okay? Usually when the needle is where the pain doctor thinks is appropriate, he or she will inject dye to make sure it's accurate. And the patients go home the same day within about an hour. How well do they work? There have been dozens of studies looking at epidural injections. Some have shown a 50% good to excellent results, but some of the well-performed studies have shown a 75 to 90% good to excellent results. The patient may need a series of 3 injections over a 6-week period to get the most pain relief. The numbing medicine kicks in right away, and the steroid may take 2 to 3 days to kick in, and that's what can last for weeks to months. What are the risks? Well, there are some small risks. Overall, the complication rate is under 1%, but there's a risk of infection. There's a risk of some bleeding. Patients should stop anti-inflammatories about a week ahead of time. There's a risk of an allergic reaction to the medicine, possibly some transient side effects of the steroid, possible nerve injury. The biggest risk is that it may just not work. Are they FDA approved? The answer is no. They are not FDA approved for use in the spinal canal. This is actually not a bad thing at all. 40% of the time, medications are used off-label effectively. It's legal, it's often beneficial. So people harp on that, but it really doesn't mean anything. I mean, it hasn't been unapproved in the epidural space. So here's 3 examples. Neurontin is FDA approved as an anti-seizure medication. It's used mostly off-label for nerve pain and for migraines. Lidoderm skin patches are FDA approved for shingles. They're used off-label all the time for back pain and other numbing needs. Propranolol is used FDA approved for high blood pressure, but it's used frequently off-label for performance anxiety. This is no different. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, including Austin, Texas, accepting over 50 insurances and providing over 25 treatment options with the board-certified physicians. In the Austin area, visit us online at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.